Well, hi everybody. This is an opportunity to talk to you about the launch of our 2018 accreditation process. It's really just around the corner, and we've just recently launched a new logo and mascot for the 2018 accreditation to get everybody focused on that event. So I'd like to tell you about that. What's accreditation? You know, it's many of you have been through them before. Accreditation Canada is a not-for-profit organization that sets standards for quality and safety in healthcare organizations across Canada and internationally. Some of you remember that our last accreditation took place in 2014, and we were awarded accreditation with commendation, which is a very, very high accreditation award. And now that we've spread lean management throughout the organization, lean really helps us in our accreditation process, helps with the engagement of staff in quality improvement processes. You know, all the daily huddles that we're doing and the leadership teams and the process improvement work really sets us in good stead for the accreditation survey that's coming up and the preparation that's required in advance of that. So 2014, those were the best results that we've achieved so far, and we think that with our lean improvement process methodology, we'll really be able to knock one out of the park in 2018. So let's take a step back. You know, what is accreditation? Accreditation is an assessment of our health services in relation to the standards that Accreditation Canada sets. As I mentioned, they're national standards. And it's really just an opportunity for us to demonstrate what we're doing well and areas that we're working on for improvement. So when the survey team actually comes on site in September of 2018, they're going to do a full review of areas like our leadership, our governance, all of our clinical programs and services against these standards that they've set. What does it mean for us? It means an opportunity for us to shine, to really demonstrate the great things that are happening at the Pembroke Regional Hospital, the work that we're all doing together to make sure that patients have a quality outcome and a safe journey through the healthcare system. But it also demonstrates to the general public that we adhere to national and international standards, the best practices when it comes to the delivery of healthcare. So that gives people in our community confidence that their local hospital is as good as anywhere across the province. Another thing that influences all of this is our patient safety culture. And some of you will remember that we did a survey not so long ago on our patient safety culture, and we had 223 responses to that survey. And it asked your opinions on various aspects of the work environment. And while your responses individually are anonymous, we received a rolled up report of the general themes. And what we found in this past survey is that we have a very solid outcome from that process. We surveyed people in a similar way in 2014, and this time we've got fewer red flags and yellow flags and more green flags. So in this survey we have 6 green flags. So that means that there's evidence, solid evidence, that we've done a great job in reporting patient safety incidents and in conducting follow-up reviews. So that's a good thing. Where we have yellow flags, there's 13 yellow flags, and in that area the general theme is that you, staff, have expressed a need for senior leadership to be more aware of patient safety issues in various areas within the hospital. So we've taken that to heart, and we're through our daily walks and attendance at huddles, we're going to be paying more attention to patient safety issues. And there were only 4 red flags versus 10 in 2014, so those are diminished. And in that area, it signals that when staff have experienced a serious incident, there's a concern that it might result in disciplinary action. And that's very much counter to what we want people to feel and experience. And that's an environment of no shame, no blame. We want people to identify incidents, potential incidents of harm or actual harm, so that we can learn from those events. And people don't come to work intending to do harm or be involved in an incident. It's the process, and our work in lean management really demonstrates this, that when you improve the process, you minimize or eliminate the potential of harm. So we can really improve on those things. So that survey is really helpful to us and helps us prepare for accreditation. So what are we doing next? As I mentioned, we've got a logo and a slogan. We had a contest to choose the logo and slogan. Sarah Mellish from my office was the winner of a $100 cash award for coming up with a Minions based logo, and the slogan is to celebrate our great. So there are great things here. We need to celebrate them. We need to identify them and be able to articulate the good things that are happening to the accreditation surveyors when they come. When are they coming? They're coming September the 25th to the 28th of 2018, so about a year from now, which gives us some really focused time to go through our action plans. Those action plans will be developed and will address priority areas that we need to really focus on during the survey. They'll focus on required organizational practices, so there are many of those areas that the accreditation surveyors will look for that are required to be in place. And so we're going to highlight each month leading up to the survey a required organizational practice of the month. And from September through November, teams will be forming and completing self-assessments for each department. And then early in the new year, from those self-assessments, some action plans will be developed. So stay tuned, get engaged with the accreditation process that's ramping up, and we're sure to have a great result in 2018. So thanks for your time and attention.